there's nothing that has the same degree of certainty as geometry. And that means that you need to have opposing points of view, well articulated and opposed to one another, to get to the closest thing you can to certainty, and to figure out where you can't even have certainty. And if you only have one side, you lose all of that. If you only hear one point of view in medicine, you know it's not going to be correct.
Tamara Ugolini for Rebel News here in Cape Breton in the small little town of Baddeck, Nova Scotia. We've traveled to the very far corner of Canada to bring you exclusive and extensive coverage of the Free Speech in Medicine conference that will take place over the next 3 days here in this small town. The speakers and topics of discussion will include various medical professionals, psychologists, psychiatrists, doctors, and more on the topics of harm reduction, whether or not safe supply is actually safe, the topic of gender dysphoria, medical transition, especially as it pertains to children, and of course the continued untangling of the COVID-19 biosurveillance enterprise. We're going to get some feedback from the attendees, why it was important to be here, why free speech in medicine is important and crucial to being able to provide evidence-based care to their patients, and how they feel as the conference comes to a close. So stay tuned.
I think that in any academic discipline, especially one that has so much influence on everybody's lives as medicine, I think a culture of free and fair discussion and debate is crucial, especially after everything that we just lived through for the past 3 years or so.
Over the last 2 or 3 years, I felt I was being told propaganda or otherwise not true message of what was going on with respect to the COVID, the policies, not to mention certain medical information.
More importantly, to connect with people who have like mind. Asking questions in these very important topic areas is hard to do, and I don't know if you can feel it in the room, but when people are able to speak freely about these most important topics, it's so organic and it's so freeing for people. So as a professional who hasn't been able to do that for a very long time, it's been really amazing to connect with these people.
Yeah, so last year's conference was focused on COVID policy for obvious reasons. You know, COVID was still top of mind last year, and we had felt so much what would you say, political oppression on medicine and the scientific process. So last year focused on that for obvious reasons. But that's, as anybody with their eyes open will realize, it's not the only controversial and difficult issue in medicine. We had, this year we talked about medical assistance in dying or doctor-assisted suicide. We talked about gender issues and gender dysphoria and transgenderism. What is the best approach to that? We talked about drug policy, safe supply. Is safe supply really safe? Does it really save lives, or is it endangering patients and communities? And those are difficult issues. And if you go to a standard medical conference, you're going to get one side on that. And that's the side of public health. That's the side that the government has approved. Many people behind the scenes don't agree with that. Many researchers don't actually agree with that, but you won't hear that at a normal medical conference. You'll just hear the party line. So we came together this weekend to talk about those difficult things.
How has the conference served as a catalyst or a means to kind of reinvigorate or spark the advocacy to continue to uphold free speech as it pertains to medicine?
Well, just the very fact that it's happening. Like people say, if you don't use your rights, you lose them. So this is a major aspect of actually exercising our rights, and the more we do that, I think better shape we'll be in.
Ultimately, the human body is something about which we can never have complete certainty. We can be pretty clear on some things, like if you have appendicitis, you should probably have your appendix out. But there's nothing that has the same degree of certainty as geometry. And that means that you need to have opposing points of view, well articulated and opposed to one another, to get to the closest thing you can to certainty, and to figure out where you can't even have certainty. And if you only have one side, you lose all of that. If you only hear one point of view in medicine, you know it's not going to be correct.
It's just confirmed my impression that that it's good to be a heretic in a lot of ways, and it was interesting to see different points of view on all kinds of things. And I didn't necessarily agree with everyone's point of view, but it was, the debate was respectful and it was vigorous, and I think that's the way we get to the truth.
And it's always galvanizing to be in this kind of situation and to actually feel like you're carrying these voices around and with some backup when so much of the program seems to be isolation.
It was crucial for us to fly here and travel extensively in order to reach this far back corner of Canada to provide exclusive coverage of this conference titled Free Speech in Medicine. If you appreciate that we can give you this kind of on-the-ground reports and conduct investigative journalism in person, then please consider donating and chipping in what you're able to help offset the costs of our coverage and our travel expenses at rebelfieldreports.com. At that website, you can also check out our reports as they continue to come out on this topic at this conference. All of that and more at rebelfieldreports.com.